Dave Sharma, thank you for joining me. 2-week lockdown now of Greater Sydney. Did Gladys Berejiklian call it too late?
No, I don't think so. I think she acted consistently with the health advice throughout all of this. As the outbreak grew and the health advice changed, she responded accordingly. Initially, there was a lockdown just for the eastern suburbs of Sydney, the part that I represent, the 4 local government areas there, but she's obviously expanded that all to all of Greater Sydney now, given the spread of it. But I think all through this government has been very conscious of the costs of a lockdown, not only to the economy and to business and livelihoods, but also to things like, schooling, daycare, mental health, loneliness and isolation, any number of other things. So I think that's why this government in New South Wales has always been careful to make sure they move in a staged and incremental fashion, depending on what the health advice says. And I think that's what they've done in this situation.
We've got a situation across the country where we've got lockdowns, strict restrictions, border closures. Are we no longer learning to live with the virus?
Well, I think the whole world is still learning to live with the virus, and the virus has, of course, changed. We're dealing with a different variant to what initially caused the outbreak, a little over 15 or 16 months ago now, and it's going to evolve again. So I think, the idea of learning to live with the virus is kind of it's a case study in sort of learning as you go along. You have to adapt, you have to change. This is what we've had to do here. If you look overseas, the UK, which has an 83% vaccination rate, they're in a lockdown at the moment. They had 18,000 new cases on Sunday, 23 new deaths. It's all of the world is grappling with this in a different way, and in Australia, I don't think we're any exception. I think we've come through this better than most countries, but certainly we're not out of the woods yet, and I don't think any country around the world is.
Do you think, though, had we progressed a lot quicker with our vaccine rollout, then we wouldn't be in this situation? We're only about 4% fully vaccinated across the country now. How much does our rollout play a part in this?
Well, it does have an important part to play. I would say that the most vulnerable cohort of people, so the people over 70, 2/3 of those have received their first vaccination. People over 50, 1/2 of them have received their first vaccination, and fully 1/4 of eligible Australians have received a first vaccination. And the rollout is happening at about 1 million doses every 9 days. So that is accelerating considerably, as you'd expect. But as I said, if you look at the overseas experience, Singapore is in the midst of a prolonged lockdown despite having a very high vaccination rate. The UK is in a lockdown of sorts and still having very high case numbers and high deaths despite having a high vaccination rate. I think what that shows you is that, look, vaccination is very important, and I'd urge every Australian who's eligible to get vaccinated. But we are also going to need to keep other public health measures in place, things like frequent testing, contact tracing regimes, social distancing, QR check-in codes, all those sorts of things, I think are going to be with us for some time yet.
You and other Liberal MPs are calling for vaccinated Australians returning from overseas to be able to quarantine from home. How do we get to that point? Because we're still seeing leaks out of hotel quarantine at the moment and lockdowns across the country.
Well, what I'd like to see, and this is what a few countries are doing, is if you're fully vaccinated, which is 2 vaccine doses, if you've tested negative 72 hours before your arrival into the country, and then if you test negative again on your arrival into the country, then perhaps we should consider that you're eligible for a different form of quarantine. Maybe it's fewer days in the current hotel quarantine. Maybe it's quarantining at home with check-in codes and things like that. But what that would do is it would reflect a different level of risk for some of these incoming travellers, and it would free up space in our quarantine program for others. Now, look, no system of hotel quarantine, no human system is going to be completely infallible, and that's why we need to make sure that we've got other, protections in place, vaccines, contact tracing, testing, and all those sorts of things. But I think it's about having a risk-adjusted approach. And I'm conscious, some Australians, particularly airline crew, are going overseas, doing a trip, coming back, having to hotel quarantine for 2 weeks, going out and doing it again. And it's months and months since they've seen their family, some of these people, and I do really feel for them.
All right, Dave Sharma, thank you for joining me this morning.
Thanks so much for having me.